Hello, I'm Ryan Tucker, an emergency ultrasound fellow at Denver Health. Today we're going to talk about the superficial cervical plexus plain block. I have no disclosures. The superficial cervical plexus is comprised of a series of superficial nerves that exit from underneath the posterior border of the sternocleidomastoid muscle. There's a wide area that is covered by this block from the lower ear to the lateral neck down to the clavicle. This is a very versatile block. It's useful in many situations that we encounter in the emergency department. As an example, this block can provide pain control for clavicle fractures. This block can also provide great anesthesia for incision and drainage procedures of abscesses in the neck, like the one shown here. The block can also provide pain control for laceration repairs of the neck. The superficial cervical plexus plain block can also be used to facilitate central line placement. It can be especially useful for placement of large catheters like dialysis lines, such as the Merker line shown here. Here is the optimal patient positioning to perform this block. The patient is in the decubitus position with the affected side facing up. The posterior border of the sternocleidomastoid is marked in purple marker here. This is a good landmark to place the probe to begin the scan. The probe is placed in the transverse orientation at the level of the mid-neck. The patient can then be scanned superior to inferior and anterior to posterior to identify the anatomy. This is a still image of the anatomic landmarks needed to perform this block. The probe marker is placed to the patient's right, which corresponds to the posterior aspect of the patient here. The red circle here marks the carotid artery sitting deep to the internal jugular vein here, seen in the blue circle. The superficial cervical plexus lies in the fascial plane between the sternocleidomastoid muscle shown here and the levator scapulae muscle body, which is shown here. The fascial plane, which is shown in this yellow line here, is your target for the block. A good place to target this fascial plane is just at the posterior aspect of the sternocleidomastoid muscle. Here is an ultrasound clip as we scan through the anatomy. Again, the relevant landmarks: the pulsating carotid artery lies deep to the internal jugular here. The sternocleidomastoid muscle is seen here. As we slide posterior, we can see the entire body of the levator scapulae muscle. The fascial plane is identified here, and this is the target for the block. After the anatomy is identified, you can set up to perform the block. After skin sterilization, a skin wheel can be placed for patient comfort, and then the needle is inserted as shown here from the posterior aspect of the patient using an in-plane approach. The probe can be slid anteriorly, as shown in the arrow here, as the needle is advanced to keep that needle tip in view. The needle is advanced in plane, approaching the target fascial plane from the posterior aspect. Once the tip is in the correct location, you can inject small amounts of anesthetic. If you see spreading of this fascial layer, then the anesthetic is entering the potential space, and this should provide for a great block. This is a still image of the procedure being performed. In this image here, the procedure is being performed on the opposite side of the patient, and so the posterior aspect of the patient is here and anterior here. We can see the shaft of the needle being advanced here with the tip of the needle here. The tip of the needle was placed directly beneath the posterior aspect of the sternocleidomastoid muscle, and injection of anesthetic is resulting in spreading of that fascial plane. 5 to 10 cc's of anesthetic is needed to achieve a good block using this technique. Thank you very much for your attention and for your interest in performing nerve block procedures that can greatly benefit our patients.